As the number of older adults living with HIV grows and is continuing growing, the issue of long-term care likewise is becoming more prominent. Today's webinar, is the third in a series of webinars delving into the issues of long-term care for older adults living with HIV, and specifically addressing the crisis in long-term care. Today's focus will be on what older adults living with HIV and the care partners of older adults living with HIV need to think about in planning long-term care, including the financing long-term care. We have an excellent panel to guide us through this discussion, and I will be introducing the panel in a moment. But as we gather and are getting all set, we'll begin today's webinar. Next slide.
Just a second, Ronald.
Again, welcome to those of you who have just joined us for today's webinar, Navigating Long-Term Care and Planning for the Future. Today's webinar is sponsored by the Association of Nurses in AIDS Care, ANNC. The mission is fostering the professional development of nurses and others involved in the delivery of healthcare for persons living at risk and living with HIV. And it promotes the health and welfare of people living with HIV here in the United States and around the world. As you can see, ANNC was founded in 1987, and the mission it strives for an effective network of nurses and others in HIV care. And inherent in these goals and the mission of ANNC is the abiding commitment to the prevention of further HIV infections and transmissions. And for more information about ANNC, you can visit our website, which ANNC, Nurses AIDS Care, Inc. A few housekeeping details. I think many of us are familiar with the usual housekeeping details. Please keep your line muted throughout the webinar. And if time allows, and hopefully we will have a question and answer period at the end. Please enter any of your questions into the chat box, and we will monitor and get to as many of the questions as possible. This webinar is eligible for professional development, and here are the details on if you are seeking using the webinar for accreditation. The details around receiving your certificate of completion, being registered, viewing the webinar in its entirety. And the deadline to claim your contact hours is December 31, 2025. Our learning objectives for today's webinar, it is our hope that at the completion of the webinar, you, the participants, will be able to discuss some of the insurance options that are crucial for covering healthcare needs in older adults aging with HIV, and also to describe estate planning essentials, including a will, healthcare proxy, power of attorney, and other essential documents that protect your wishes and assets. Disclosures: the planners and presenters of this educational activity have no relevant financial relationships with ineligible companies to disclose. Our faculty and our panelists today include Kevin Lish. Kevin is the finance director at the Zero Project. Kevin began his advocacy career nearly 20 years ago after his HIV diagnosis and a chance meeting with Sean Strube in Boise, Idaho. Kevin, as I said, currently serves as the financial director for the Zero Project and has the pleasure of supporting the rest of the staff with Zero's daily financial operations. It involves overseeing budgeting and monitoring programs that allow Zero's continued growth and commitment to the people living with HIV community. Prior to joining Zero, Kevin retired from the Mutual of Omaha companies after 35 years as a financial advisor, earning several professional designations. 12 of those years, Kevin was a district sales manager for Mutual of Omaha, leading the Idaho agency. Our next panelist will be Dave Bagley. Dave is a clinical professor in the Idaho State University College of Business and is of counsel with the Idaho law firm Racine Olson PLLP. His law practice focuses on estate planning and probate and trust administration. He received his bachelor's degree in English from Brigham Young University, his law degree from the University of Idaho, and his master's in tax law from the University of Florida. He is also a high school baseball coach and enjoys fishing and watching TV. And in our panel discussion, we also will be joined by Tana Pradia. Tana is a long-term survivor of HIV, resides in the Houston, Texas area, and has been long active in community affairs, particularly those related to being a person living with HIV, including her involvement with Positive Women's Network USA. To get us started, I'll turn to Kevin, who will get us started in our discussion of planning long-term care for older adults living with HIV. Kevin?
Thanks, Ronald, and welcome everybody. I am going to take you through some of the basics of long-term care insurance and hopefully explain why it's really important to develop a relationship with someone like Dave, because long-term care insurance may not be an option for a lot of us. And so next slide, please. Okay, so how do people normally pay for long-term care? This is something that I used to start an appointment with when I would go out and start the fact-finding process with a new client or an existing client interested in long-term care. There are three sources to pay for long-term care. The first are our personal savings. The second, well, I put question marks on Medicaid because we'll see how Medicaid shakes out after all the changes being bandied about in Washington, D.C. right now, and then insurance. And, you know, if I was doing my good job as a financial planner, you know, I need to know enough about you that I can bring all three of these circles into focus, because you know the way long-term care insurance works, I do need to know what kind of savings you have, because there's no sense in you paying me too much premium if you can have a longer elimination period or a deductible period, because you have accumulated some nice savings. And then also, this is something I used to tell my clients, and it was kind of a tongue-in-cheek joke, but it is something that I think kind of boils it down to a nutshell. There are two types of folks that don't need long-term care. One, you know, you've accumulated enough wealth and you can pay for it out of pocket. No sense in giving me any insurance premium because, you know, while it would be nice, you have enough money to pay for it out of pocket. So that that eliminates most of the people in the United States because, as I'm sure all of you know, long-term care can be extremely expensive. And then those who are already close to the Medicaid limit in your state for income and assets, Medicaid would be your provider of long-term care. And again, it would not make any sense. In fact, it would be unethical for someone like me to sell you an insurance policy to cover long-term care costs if you were very close to Medicaid eligibility at the time we were talking about it. That is frowned upon by state insurance commissioners. And so, my job is to help you understand, bring these three circles into focus and help you build a long-term care plan that makes sense for you. And a lot of times, I don't know if you all noticed, Dave and I are both from Pocatello, Idaho. A lot of times that meant that I would have to call my buddy Dave and get him involved because a client's financial needs may require more than what I could do as an insurance agent. And we needed a great estate planning attorney, which Dave is. And so he and I worked quite a bit together. And I am going to ask Sheila to go to the next slide, please. Okay. Here's a question I used to get all the time. Well, what about Medicare? What about my Medicare coverage? And Medicare pays for skilled care. It does not pay for custodial care, and we'll go into the different types of care in a few minutes, but it only pays for skilled care. And skilled care is recuperative care. You have a diagnosis that you're going to eventually get better, or they hope you're going to get better. It would be like after hip surgery, So, sorry, I didn't. It just hit me as funny. From our conversation before we started, or care after a stroke. So your diagnosis is you've had something happen, but if you get enough skilled care, then you can return to normal health. But it also requires a 3-day prior hospitalization as an inpatient. The only way Medicare will pay for skilled care is if you've been in the hospital as an inpatient, not an outpatient, you have to have actually been in the hospital for 3 days, and then it will pay for 120 days per benefit period. And again, skilled care only. It does not cover custodial care. Next slide, please. So that brings us to the levels of care. There are 3 basic levels of care that people need, and they buy long-term care insurance for. The first one is skilled care, which we just discussed. You've had a procedure or had an accident, and you are recuperating, and you're expected to get better. Then there's hospice care. Most of us know what that is. We've gone through it with a parent or a grandparent. You're at the end of your life. There's not much medical care that can change your inevitable death. And so that the care you receive is comfort care, or to make sure you're comfortable as your life takes you to the next chapter. And then what we're really talking about, and where most people need help, is something called custodial care. That's care, I'm getting there really quickly, care that most of us need just to get through the day, whether it's toileting or bathing or transferring. These are the types of care that long-term care were designed to cover. And Medicare, when it was passed in 66 or 67, was never designed to cover custodial care. And that's why it fell to the Medicaid system. And the thing that's interesting to me about this when doing long-term care planning is one can usually bleed into the other. It's not unusual for someone to start out in skilled nursing and their health deteriorate a little bit, and it becomes a custodial care situation where they come out of the skilled nursing facility and into an assisted living facility. And then, of course, sometimes in the most bad cases, skilled nursing care can lead to hospice care, and for some of us, custodial care will lead to hospice care. That's why a good long-term care policy will pay for all 3, because once you start receiving care, the time clock on your elimination period needs to start. And that means from day one, if you get 90 days of skilled care, all of those 90 days need to count toward your elimination period, which is how long you must wait before an insurance policy will start paying. And so that's why it's important to understand that no matter where you start, that those days must count towards the elimination period of a long-term care policy if you choose to buy one. Next slide, please. So here's a little history. I started in 1989. And so prior to 1980s, I like to use my family a lot. I had a wonderful great-grandmother, Grandma Titus. And when we first moved to Idaho in 1967, my grandmother, Grace Lish, would have my great-grandmother in her home once a month. My grandmother had 11 brothers and sisters. And so I know my great-grandmother today. I know today she had Alzheimer's or dementia, one of the two. But, prior to the 80s and even some into the 80s, we depended on our families to give long-term care. It was people like my grandmother Titus that would visit one of her children a year. And, she had 12. So she got to see all of them once a year, and they all helped with her care. Then in the 1980s, insurance companies started coming out with nursing home coverage. And that had a flaw in it because it was nursing home coverage. And so the only thing it would cover would be care in a nursing home. And I'm trying to think back. I'm not sure if we had many assisted living facilities in the 80s. They really started kind of growing after that. And then about the time I started in the insurance business, companies started releasing products called long-term care. And what they did is that not only do they cover nursing home, they started covering an umbrella of what was to become our current long-term care market. And in fact, in 1989 or early 1990, right after I started, I was asked to come into my general agent's office, and he said, "Guess what? We have been chosen to help market a new product Mutual of Omaha has, and it was our first ever long-term care product." And that again was in 1990, and I was involved in the very beginning of the long-term care product line that has grown and grown and grown. And so, yeah, this is something that I always really enjoy doing. And then today, it continues to evolve. You can buy long-term care policies are much better today than they were in the early 80s and 90s. And also you can somewhat take care of the need with life insurance and also some annuities. And one thing before we go on, I want you to understand why it's important about life insurance and annuities. One of the things that I don't think agents take enough time explaining is the way policies are underwritten. Life insurance is underwritten on something called mortality. Long-term care, disability, and health type products are underwritten on the basis of morbidity. And the difference is, let's use the example of a bad back. I may have a really bad back, and if I want a $5 million life insurance policy, no one's going to care. They're going to issue that all day long because people die with a bad back, not of a bad back. But on the other hand, disability long-term care, when they're looking from a morbidity standpoint, then they're starting to think, okay, well, he has a bad back. How likely is that to not allow him to work? Or how likely is that to require some sort of confined long-term care or even care in the home? And so again, the way I used to tell clients to think about that, one is not better than the other, but you just have to understand what an insurance company is looking for. Again, life insurance underwriting, they're looking for things that could lead to death, imminent death. morbidity underwriting for long-term care and disability type policies. They're looking for things that could lead to you not being able to work or not being able to take care of yourself. Next slide, please. Great. Okay, so long-term care coverage. You want to make sure, if you're thinking about this, that you want to make sure it covers all types of long-term care. And we'll go into this in a future slide in a few minutes. But you need to make sure it covers assisted living, adult daycare, home health care, homemaker services. And then a really good plan, in my opinion, also does something called personalized plans. The company I sold for, we had a whole slew of RNs, and I could pick up the phone. My mother has a Mutual of Omaha long-term care policy I sold her, and I could pick up the phone and say, hey, I'm not sure how to handle what my mother's going through. And one of the nurses at Mutual of Omaha would help me figure out the best type of care for her. And to me, that's really important because, as we all know, going through life living with HIV, a lot of times one type of care doesn't suit us all. Sometimes it does need to be individualized. Two, this is probably the most important thing I can leave you with today. What triggers your benefits? A good long-term care policy gets triggered on something called the activities of daily living, which I'm going to take you through in a few minutes. You do not want a policy that covers you based on medical necessity, because then you're back into, just like you are with health insurance or any other type of insurance, you're arguing with the insurance company on how sick you really are. And that's never a good place to be. One of the things that has been really unfortunate, in my opinion, is the premium costs that are now associated with long-term care. It has become very, very, very expensive. I mean, I can remember when the first policies rolled out in the early 90s, I could cover a husband and wife really well for $110, $120 a month. And even if they would give me 60 or 70, I could build a pretty nice plan for them. Today, well, 2 years ago before I retired, that might be $700 or $800 a month. It has really put long-term care insurance out of the reach for most of us getting ready to retire. And then the other thing that was a little kind of a shame about long-term care insurance is the way it's underwritten. It is the hardest type of policy to get approved and get a deliverable policy back to your client. Underwriting is stringent. Unlike any other type of insurance I sold, I was dealing with RNs as underwriters. No one else had that level of education. Even if it was a $10 million life insurance policy, I was not dealing with a medical professional. They're comprehensive, and a lot of times there is just absolutely no wiggle room. No matter what kind of relationship you built with an underwriter, it was really hard to say, well, to make an argument once they had determined how they interpreted health. And normally health is determined by them writing and getting your doctor's records. And so it is definitely a challenge to get a long-term care policy approved most days. And that's why I am so glad Dave is here. I don't, if I applied today for long-term care insurance, I think my underlying health condition of living with HIV, I don't think I'd find coverage. So that's why we need to turn to folks like Dave to help us as we navigate this part of our retirement planning. Next slide, please. Great. So let's talk a little bit about comprehensive coverage. Again, you want to make sure you have a policy that covers assisted living. And then, of course, assisted living, I'm sure most people understand what an assisted living facility is. It does not necessarily have a nurse on staff 24/7. A lot of the care is given by home health or health aides. and it just does not provide a lot of the same medical services that a nursing home would. But also with assisted living, a lot of people can take their cars and leave whenever they want to, and their family can come get them and take them out for lunch. A lot of times, in my experience, once people hit a nursing home, an old-fashioned nursing home, well, I'm nearly 64, so in my mind, a nursing home was someplace that I never wanted to be. Seeing my grandparents go through it. Usually when people land in a nursing home, going and grabbing you for lunch or bringing you home for a holiday doesn't happen much. And then, of course, in the 90s, things called adult daycare started popping up. All of a sudden, women weren't providing long-term care insurance or long-term care anymore. We started having sandwich families where a family might have 3 kids and a parent living with them. And so what adult daycare allowed folks to do, especially when they had insurance to pay for it, is both mom and dad could continue working because they needed to make ends meet for the family, and they could take grandma or grandpa to an adult daycare center, which would have activities and things for people to do if they weren't okay to be left alone at home anymore. Home health care services, I would say the majority of long-term care policies thank God, are paying for home health care services, where a professional home health care aide comes in and helps you with things. And a lot of times it's 3 to 4 times a week. I have had clients that have tried to set it up to have home health care aides come in 7 days a week. And at that point, that would be so cost prohibitive. At that point, it's probably time to start looking for an assisted living facility for your loved one. One of the things that we kept screaming for from the field is if you have a person that needs this kind of help, how do you expect them to dust? How do you expect them to vacuum? How do you expect them to go to the store and buy groceries for themselves? And so we finally screamed enough from the field that a good long-term care policy now has homemaker services. So someone can come in and do those types of things. And then, of course, again, because of the elimination period, you want to make sure the policy covers skilled nursing care, even though Medicare is probably going to pick up the majority of that. And again, hospice care, and then also shopping assistance. And then again, the ability to work with a professional at the insurance company and the claims department to put together a personalized plan. And those personalized plans can become very, very sophisticated, or it may just be helpful for you. You call up and say, hey, I think my mom needs some kind of help. I'm not sure what kind it is. They may send you back an analysis of who they think would be the best person in your town for you to get services for your mom or dad or another loved one. So they can be very, very helpful and should be a part of a policy if you're thinking about purchasing long-term care insurance. Next slide, please. Okay, so the activities of daily living, claim triggers. Again, this is really, really important because, again, these policies are expensive. They need to pay when you need them to pay. And so activities of daily living became an industry standard, I would say, sometime in the late 80s to early 90s. And these are the activities of daily living: bathing, dressing, toileting, transferring. That's from getting from your favorite chair to the bathroom, or from the bed to a chair, help moving around your home, eating, and continence. If you are incontinent, that is one of the activities of daily living. So the policies I sold, if you were unable to perform one ADL, that would trigger either home health care or adult daycare. If you couldn't perform 2 ADLs, then you were eligible to receive benefits for all levels of confined care, plus home health care and adult daycare. And again, when you're buying long-term care policy or for disability insurance for that matter, what triggers the benefits is the most important part of the policy. I can't stress that enough. Do not buy something where you have to argue with the insurance company whether you are sick enough for them to start paying these benefits. And just like with a good disability policy will cover you if you can't do your job. It doesn't matter whether or not you can flip hamburgers at McDonald's, but if we take Dave as an example, because I can see him, if a good disability policy would cover Dave if he couldn't be an attorney. And so again, on these types of policies, look at how you get paid. Not the benefits are important, but it's really important on how you receive money back from the insurance company. Next slide, please. So some of the newer non-traditional methods of coverage are life insurance. And the nice thing about using life insurance, riders on life insurance, is usually it was some type of a rider where, again, our policies had a trigger of an activity of daily living, and some combination of future death benefit or cash values would be available to pay for these types of things. I'm going to be the first to, it is not the most comprehensive of long-term care coverage, but if I knew someone who could qualify for this, and I didn't think they had much of a chance to qualify for long-term care coverage, it was a great solution. And then also it got me back to be able to have people's health looked at from a mortality standpoint versus a morbidity standpoint. Because my experience, life underwriters are a heck of a lot easier to work with than a long-term care underwriter. And then something that came out probably about 12 years before I retired from my first career were something called long-term care annuities, and I sold a bunch of these. I love this product. Ours was typical of most on the market. After 2 years, if you gave me $100,000 in an annuity, after 2 years of those deposits being left in the annuity, if you had an activity of daily living, whether it was 1 or 2, I don't remember now, your annuity then kind of became a long-term care policy, and most policies would either double or triple the amount that you gave the insurance company. So if you gave me 100,000, it had grown to 106,000. The policy I sold, you would have 318,000 available for long-term care coverage if you had had it for 2 years. Very low underwriting, very low underwriting. And again, I've already mentioned a good long-term care annuity uses an ADL trigger, an activities, a daily living trigger. And the sad thing about these annuities is after about 4 years and people really loving them, because you can really kill 2 birds with 1 stone. You can give an insurance company money as savings in an annuity, and if the worst case happens, then it kind of converts and you have money to pay for your long-term care. And what I would tell a client is you use this annuity as your last pocket of savings. This will be the last money you spend before you go. And so they had it for savings, and then if something happened to their health and they needed it for long-term care, again, they weren't really buying anything. They weren't giving me any premium dollars. They were taking money out of their front pocket and putting it in their back pocket. But the sad thing is today's interest rates, low interest rates, most of them have been pulled from the market because insurance companies cannot get a good, safe investment to invest the excess premiums in to make the policies viable. We never pulled ours from the market, but it hasn't been available for sale for about 8 years because they just couldn't find anywhere to put the money that got them what they needed to be able to continue sales of the long-term care annuities. And I think this is where I turn it over to Dave. But if you have any questions for me, here is my email address and my phone number. I'm no longer licensed, so I can't put the tush on you to buy anything, but I'll be happy to answer any questions you may have. And with that, I will turn it over to my buddy Dave Bagley.
Thanks, Kevin. Sheila, do you want to give me oh, okay. Actually, can I drive? Am I allowed to do that?
Yes, so you should be allowed to drive. You just
Sure.
should be able to
There we
share your
go.
screen now.
Oh, you're the best, Sheila. Thank you so much. Let's see if I can
And just a reminder, while Dave's getting that up, we will have a panel discussion and questions and answers um, after Dave's presentation. So please feel free to enter questions into the chat box and we will get to them.
who's the how do I make this so it doesn't do the little next slide thing? Who's the
I think you are sharing your
talented
screen.
person?
You are
So
sharing your screen right now.
yeah, there's this little, can you guys see it shows like one and then it shows next slide over here?
I'm not seeing
Or
that.
do you see just a slide, just like a does it look
Yeah,
all right?
yeah, it looked normal, Dave, just like a normal slide deck.
Oh, it
Yeah, it
does.
did.
Okay, perfect. Okay, for me, it's showing me different things. So that actually that works out great. Oh, there is a question in the chat. It says, "Do you mean that I have the option to sell my life insurance and use the money to establish?"
Dave, we'll get to those questions afterwards. So, but I've noted that question that's in
Okay.
the chat. We'll get to
Okay.
that.
Okay, perfect. Um, Ronald and Sheila, do you want to wait on questions until after, or is it okay if people ask questions while I'm presenting?
I think
Go
we'll
through
just,
go
oh,
ahead, Sheila.
I was going to say, I think we'll just wait till the end to make sure that we can get
Okay.
your full presentation for
Okay.
everybody, and then we'll have that panel discussion with questions at the end.
Okay, that's great. And then how much time what time do you want us to end? To
So
want me?
the session is scheduled to go until what time do we start? It's an hour and a half, so we're
Okay,
scheduled
perfect.
until 3:30. But hopefully, don't
That's
take up
great.
all that time, Dave. Give us some time for
Oh, you sure? I love my favorite sound. My favorite sound is my own voice. So, okay. First of all, I'm grateful to Kevin and Sheila and Ronald for letting me join you guys. This is, for me, this is a real honor, and I'm grateful. Um, I also want to shout out Randall. So over here, I have a screen over here that has the chat on it as well. And it looks like Randall is from Phoenix. I grew up in Phoenix, Randall, so that's kind of exciting. I grew up on 7th Avenue and Thunderbird Road, and went to Brophy for a little while, and then graduated from Thunderbird High School. So I don't know if you know any of those places, but glad to have another Phoenician here. Um, Please do think of questions as I'm talking. It would be great for me if you would think of questions or put them in the chat, and then we can get through the slides and then address those questions. I really makes me feel great when people ask questions, so it would make me feel good if you do have some questions. Nice, Randall. Let's get you from Awatuki. That's great. Or a walkie. I might not. I'm a lawyer. I can't read sometimes, so. But hey, Randall, that's awesome. Um, okay. Now, a couple of important things before we get started. First of all, go Gators. I got my LLM in tax from the University of Florida after law school, and Gators. I graduated in 2006, and I have picked the Gators. Alexa, go Gators. That's awesome. I have I have chosen the Gators every year to win to win the basketball championship. And this year I didn't do a bracket because I've just given up. And I didn't do a bracket this year, and it's the year they win. And it's been 19 years of doing that. So yeah, crazy. Gators are a great community. So Alexa, that's awesome that you're here. Um, you got it, Randall. Yeah, Awatuki, that's awesome. The other thing is, this is really important. I am much better looking than I look like on screen. People tell me all the time I look like Brad Pitt, and I feel like on the screen I look like Voldemort a little bit in the Harry Potter movies, or um, Mr. Potato Head. Neither one of those are accurate. The camera does weird things. So just keep in mind, Kevin, you would back me up on that, right? I'm super hot. Would you agree?
Yeah, I didn't mention that my Mutual of Omaha office, we used to share an office. The head of Racine Olson and John Squires built the office together. So I almost fainted a few times when Dave and I would pull up at the office at the same time. He's so nice looking.
Kevin, you've always been my favorite, but now you really are. Now it's recorded for everybody to know. Um, so Sheila, thank you for notes. I appreciate that, Sheila. That's kind of you. Okay, so let's get rolling. Let's see if I can make these things work. So welcome everybody. You've already been welcomed. Um, and thanks for letting me join in your community. Uh, you know, um, I've known Kevin for a long time, and he's one of my heroes. And I'm grateful to be able to dip my toe a little bit in your community and join you. So I appreciate you being willing to let me join you. All right. So what is estate planning? So estate planning, uh, writ large, is planning for two things. It's planning for how decisions are going to be made while we're alive, but can't make those decisions, and then also planning for the distribution of our assets when we die. So before death, how are we going to make decisions if we can't actually do that ourselves? And then number two, when we die, how are our assets going to be distributed? Those are the two, I think, primary roles of estate planning. And we do that through a couple of things. We'll do it through wills or trusts or both, and powers of attorney and post forms. Now, and we're going to talk about each one of those in a little bit more detail. Um, and it's important to note at this point, I think, that I'm licensed in Idaho. Uh, Generally, the rules related to wills, trusts, powers of attorney, and not all states recognize post forms. We'll get into those in a little bit, but generally the rules are pretty similar across different states. The details can be there can be differences in details, but the big picture, this will apply wherever you're at. So uh, I think the information will be worthwhile, even if there's nobody else in Idaho other than Kevin's. But I think the basics are going to apply to all of you, or at least be worthwhile. Okay, so why should we do our estate planning? Well, I think the number one reason personally is to try to avoid the likelihood of our loved ones fighting, because there used to be a lot of estate tax concerns, or some people call them death taxes, but there used to be a lot of estate tax concerns. And we would do estate planning to try to reduce the tax consequences of dying and then trying to transfer assets. But now the estate tax rules are pretty generous, and so we really don't. Most people don't have a concern. 'Cause right now, as long as you have 13.9 million or less than 13.9 million dollars when you die, and you haven't made gigantic gifts during your life, you're not going to have an estate tax or death tax problem. And that number is scheduled to go down at the end of the year, but there's the budget right now that's been proposed in Congress, and various proposals in Congress have indicated a desire on at least the Republicans' part to extend that $13.9 million rule and not let it be reduced at the end of the year. You can ask questions if you want about that. It's not if you have, over $13.9 million, then you really need to talk to me. Just kidding. I'm just joking. You need to talk to somebody though. But if you have $13.9 million, you need a driver or a gardener or someone to make sandwiches for you. I am your guy. Well, I was about to say I'm a great driver. I don't know that my family would actually agree with that, but okay. Now, why else should we do estate planning? So we want to do estate planning so that our assets are distributed according to our wishes, not according to a default plan provided by the state in which you live. Most states, if not all, have a default estate plan for everybody, and it's usually called intestate succession, which sounds like a healthcare issue. It sounds like, my dad had prostate issues. I assume I'll have prostate issues at some point. If you're going to have a colonoscopy, I recommend that you have your prostate exam during the colonoscopy. Just get everything done kind of at once. I had 4 colonoscopies last year, so if any of you want to talk about colonoscopies, I feel like I'm an expert at this point. Um, so anyway, okay, intestate succession. So intestate succession, that's what it's called when you die without a will or a trust, without some kind of a plan in place, and the state just provides a default for you. And it just depends on your circumstances and your state, what will happen with your assets when you die. Sometimes that intestate, that default plan, sometimes it might be what you want. A lot of the time, it's not what people would normally choose. And so I think there's a lot of benefit to doing your own estate planning so that you don't have this default plan kick in and result in your assets going places that you maybe didn't want them to go. Okay. Now, let's talk about wills and put down, again, put questions in the chat that we can talk about later or address later, or just write down questions because oftentimes there are a lot of great questions. So, also, I just want you to note the pictures in my slides. I think they're awesome. The language and like what I'm saying isn't worthwhile. The pictures are really worth looking at. Like this photo, I think is amazing. I don't know who took it, but it's beautiful. Okay, so we talked about intestacy a little bit. A way to avoid those default rules kicking in is to have a will. That's the most basic approach. So what do you do with a will? Well, a will allows you to appoint someone to be in charge of your estate when you die. And that person is called an executor or sometimes a personal representative. In Idaho, the legal term is personal representative. We call them a PR. But executor is the term that most people are familiar with. So if you have a will, you can say, I want Kevin to be in charge of administering my estate when I die. That's number one important thing. Number two is you get to plan or provide your plan for the distribution of your assets. Now, it's super duper important. There's a slide later about this. Your will only controls certain assets. If you have a beneficiary designation on an account, then your will, at least in most jurisdictions, your will is not going to control that asset. So if you have, for example, you have a 401k or an IRA or a life insurance policy, and you name if you designate beneficiaries on those accounts, which you should do, those are not going to be controlled by your will. They're going to be controlled by the contract that you have with the financial institution or the life insurance provider. And the company's going to distribute those assets to the people you've named in that contract through designating the beneficiaries, right? So probate assets typically are real estate, so your house, if you have second homes or other types of real estate, savings account, checking accounts, vehicles, and taxable stock accounts. So non-tax deferred stock accounts. So anything outside of a 401k IRA, 403b, 401a, things like that. Okay. Oh, somehow I did something that made me not be able to change the slide. Oh, there we go. Woo-hoo! All right. So what about trusts? A lot of people have questions about trusts, especially if you live in a state where probate costs are high or where probate is very expensive. So California, if you live in California, you should absolutely have a trust because the costs of administering an estate through the probate process in California are prohibitive. They're ridiculous. Now, actually, I just realized I need to talk about probate. I was supposed to talk about it that last slide, and I got sidetracked. I get so excited sometimes, guys. Sorry. So probate is the process through which a court determines if a deceased person has a valid will or not, and actually names the person who's going to be in charge of administering the estate, so the executor or the personal representative. You're not the PR in most jurisdictions. You're not the personal representative or executor until a court has named you, has actually issued a document naming you as the executor of the estate. And a will typically isn't valid unless a court has said, yep, a judge has reviewed it and said, yep, this is a valid will. Then the will becomes valid. So that's the probate process. Uh, it's that court-appointed process that accomplishes those two things. Now, I often run into people who say, well, I have a will, I don't have to go through probate. No, 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 that's not accurate. If you don't have a will, or if you do have a will, you're going to have to go through probate in most jurisdictions if you own real estate in your own name, in your individual name, or if you don't own real estate, but you have uh, a certain amount of assets that don't have beneficiary designations. That might be a little bit confusing. So write down questions if you want to talk about that later. But just general rule of thumb is um, you're going to have to probate if you own real estate. And if you don't have a trust, you're probably going to have to go through the probate process when you die, generally. Now, there are ways to get around that, and some states make it easier than others, but that's just the general rule. So jot down some questions that we can talk about that. Okay. Now, trusts, there's a billion kinds of trusts, but the trusts we're going to be talking about today they're typically called a revocable living trust. So that's revocable living trusts or inter vivos trusts or probate avoidance trusts, things like that. Now, if you use one of these types of trusts, you can avoid that probate process and make things easier for your surviving for your heirs, your beneficiaries. But generally, these types of trusts, all they accomplish really is they just allow you to not have to go through the probate process and involve the courts. So if you have done a trust correctly, generally, and kept it maintained, you don't have to go through that probate process. But the way that you avoid the probate process using trust is you actually transfer the property that you would otherwise have to probate, you transfer that property into the trust before you die. So that usually is real estate, your home, any other real estate, and your savings account, your checking account, and your non-tax deferred accounts, stock accounts. And Sheila, I see you have a question. That's great. We'll get to that. That's awesome. So you have to be really careful funding trusts. For example, I don't like putting vehicles into trusts. Some estate planners do. I just think I had a scary situation with one client who did their estate planning with someone else. They came to me. I was helping him revise some things, and they said their vehicle was in their trust. And I said, "Oh, okay. I don't usually do that, but check with your insurance provider. Make sure that you have car insurance. That they know that your trust owns the car, and that you have insurance." And I don't know if this is true or not. Some of you who are insurance professionals would know, and it might depend on who your insurance company is, but they came back to me and they said, wow, we went and talked to our insurance company and they said they didn't know it was in the trust and we didn't have insurance. And they'd been driving for a few years under that arrangement. That scared the crap out of me. So I just don't know. I don't know enough. I don't like having vehicles in trust. It's my personal opinion. In Idaho, it's really easy to transfer vehicles when someone dies, so we just don't put them into trusts. I also want trust to be private, and if there's a car accident and a lawsuit, then the trust as the owner of the car is going to be, disclosed in court. So, but if you're in California, it might be, for example, if you're in I don't want to pick on California, but I've had experience with probates in California. And if you're in California, you might want to just put everything in there. You just got to make sure that you dot all your I's and cross all your T's, and so you have insurance and you have all the protection that you need. Okay. Let's see. Now, with these probate avoidance trusts or revocable living trusts, you maintain control. The person setting up the trust maintains control of all of their property. You can sell assets, you can add new assets to the trust, you can pull assets out of the trust, do whatever you want to do. You're totally in control, which means, of course, that because you're in complete control of those assets, you also don't have asset protection for those assets that are in these types of trusts. There are trusts that you can set up where you can put the assets into the trust. They're called irrevocable trusts. You can put your assets into the trust and protect those, shield those from certain types of liabilities. they're not my favorite. There's a place for them. I don't do very many of them. I think if you have concerns like that, um, you need to go to an expert, like an estate planner who really focuses on using trust for asset protection, because there's a lot of pitfalls for the unwary, and so you need to go to somebody. If you want to do that, you got to go to somebody who's an expert in that. Again, these trusts we're talking about are really just used to avoid the probate process. And Sheila brought up a great question, actually. So people don't like probate for three reasons. They don't like it generally because there's a cost associated with it. And in Idaho, it's relatively affordable. Probate might cost if there's two partners or a married couple and they both pass away and we're dealing with distributing things out to the kids. In other words, there's not a surviving spouse. Um, there's more to a probate in that circumstance, and probate in Idaho will cost somewhere between $1,500 and $4,500, just depending on the circumstances. Most of those are attorney fees. The court really doesn't charge much to file the documents. The newspaper doesn't charge much to publish notice. And so in Idaho, you're looking at $1,500 to $4,500. Now, I suspect that's pretty low. I suspect that in other states, certainly California has different rules. It's super expensive to do probates in California. But anyway, cost is one of those three reasons people like to avoid probate. The second is delay. It takes some time because you have to submit documents to the court, and then the court has to review those and issue a decision, issue the statement of probate and the letters appointing the executor. In Idaho, again, that might take a couple weeks, maybe a week. So it's pretty quick. California, it might take, quite a bit longer. And I don't know what your state is. You'd have to ask somebody to see, how long does a probate take to get somebody appointed as the executor, which is the real delay typically in a probate. So the third reason that people, and oh, sorry, let me finish that about delay. Once you get the executor appointed, a probate takes about as long as a trust administration would. There's really no difference in my experience at that point. It's true that with a probate, you can publish notice in the newspaper, and what that does is it provides a 4-month creditor period for people to submit bills to the estate and say, hey, you owe me money. The deceased person owed me money. And that's nice to have that 4-month period, because in most jurisdictions, it's actually a 3-year period if you don't publish notice. But you can still take care of everything, right? You could sell property right away as soon as the executor is appointed. You can start selling real estate. You just have to maintain enough money to pay any bills that come in. You have to do the same thing in a trust. I mean, you don't have to publish notice in the newspaper with a trust, but you still have to pay bills and make sure that you have all the bills that have come in for the deceased person and make sure that those are paid. So I think the primary delay in most states that I'm aware of, other than California, the primary delay is just that initial period. Now, some states make their probate process burdensome, and you have to go through the court. You have to go to the judge and ask permission for more things. Again, Idaho, it's just not like that. But some states, you may want, if the probate courts are much more involved and want to review what the executor is doing on a more frequent basis, then that would be another reason to avoid probate and to use a trust. So the third reason, those are two, cost and delay. The third reason is that people like to avoid probate is because it's a public process. So in most states, you can go and sit down, go to the probate, you guys could go do this for fun. Go to the probate court, sit down and say, I'd like to start looking through probate files. I know somebody died the other day. His name or her name is so-and-so, or their name is so-and-so. And I'd like to look at their probate file. And you can open it up and look at their will. You have to submit the will to the probate court, see who their beneficiaries are, all sorts of things like that. So some people don't like that idea that it's all public. That's just a personal decision. So those are the three reasons people like to avoid probate. The way that they avoid probate is you use trust. That's the proper way to do it. Okay, now let's move on to powers of attorney, because I don't want to take too much time. So I'll try and go quick here. All right. A power of attorney is a document that someone signs appointing someone else to make decisions on their behalf. Now, when I sign a power of attorney, I don't give up the right to make my decisions. I'm just saying this other person can also make those decisions. So my wife, Danielle, I name her, I sign a document saying, okay, my wife can make my financial or my healthcare decisions. I'm not giving up my own right to make decisions. I'm just saying that, okay, bank, you can listen to Danielle and take direction from her. Hospital, physicians, you can listen to Danielle and if I can't make my own decisions, you listen to her and she'll make those decisions for me without having to go through a court process. Now, powers of attorney go away when someone dies. So if I passed away, my power of attorney is no longer effective, except under very rare circumstances. And this is important. In many states, the person who is legally entitled to make your health care, or sorry, not your health care, to make your funeral arrangements is the person named as your healthcare agent under your healthcare power of attorney. Super interesting. I think it's a worthwhile idea to put your funeral wishes in your healthcare power of attorney. Oftentimes, there's a place where you can customize some things in a healthcare power of attorney. I think it's a great idea to say, I want to be cremated. I want my ashes sprinkled wherever. Um, Now, you're probably encouraging your loved ones to break the law because, you're not supposed to just go sprinkle ashes in the ocean, for example. It happens all the time, and I'm not going to condone that. But it happens all the time. So I think the healthcare power of attorney is really the best place to put your funeral wishes. If you want to be cremated, if you want to be buried, whatever. Because oftentimes wills aren't looked at until after somebody's buried, in my experience. Sometimes they're, but sometimes they're not. Okay, there's a financial power of attorney, there's a healthcare power of attorney, and let's move on. Okay, so let's talk about physician orders for scope of treatment. Now, when you do a healthcare power of attorney, let's go back. Let's go back for minutes powers of attorney. When you do a healthcare power of attorney, oftentimes there will be a living will attached to that, or it's also sometimes called an advanced directive, or I call them an end of life directive. And it basically says if I'm terminally ill, I'm unable to rationally communicate, my death is imminent, and artificial life support will only serve to prolong my life artificially, or if I'm in a persistent vegetative state, I want the following to be done. And oftentimes what the following is I want to have pain medication and I either do or don't want to be on artificial life support, or I don't want to be on artificial life support, but I do want to receive nutrition or hydration or both. So typically an IV or a feeding tube. Most of the time people say, I don't want to be on a ventilator. Just let me go. Well, for you to have and to think about. Don't think about it too long. It'll make you depressed, but you want to think about it and you want to have that conversation with your estate planner and maybe your physician as well, maybe some family members. The nice thing about doing an advanced directive is that you're making that decision rather than making your loved ones make the decision for you. Now, our end of life directives, living wills, are they perfect? Absolutely not. Absolutely not. Sometimes physicians make mistakes. Maybe you're not as ill, maybe you are going to recover, but a physician says, no, you're not going to recover. So these things those kinds of decisions take some thought and some care for sure. So, all right. Now, physician orders for scope of treatment. All right. Post forms. They're called different things in different states. These are documents that will overrule your living will or advance directive. You fill them out with a physician, or in some states, you can do it with a nurse practitioner. And they're more detailed typically than an advanced directive. And the physician or nurse practitioner has to sign them for them to be effective. You can include, for example, a do not resuscitate order in a post form. Typically, a do not resuscitate order isn't, well, it depends on the state you're in and the form you're using, but a lot of the time, an advanced directive or living will does not include a do not resuscitate order. It's only if you're terminally ill, your death is imminent, all that kind of stuff. Whereas do not resuscitate orders are much more broad, as many of you know. You guys are in this world, so I think there's 43 states that recognize post forms or some kind of iteration of a post. And in 37 states, nurse practitioners can sign those. So, okay. Really quickly, wills are less expensive than trusts. Trusts are more expensive than wills. In my experience, it's a little bit of sixes. It's six of one, half a dozen of another. You can pay less for a will now, but then when you die and you go through the probate process, your estate's going to pay that extra cost of probate. If you do a trust now, you're going to pay more, but then you're going to avoid the probate process, you're going to save money later. So in my experience in Idaho, I charge generally for a really simple probate avoidance trust. If you're in Idaho, I can't do this for people outside Idaho, but if you're in Idaho, I charge $3,000 for that. If you do probate, if you die and if you do a will and then you do probate, you're looking at about maybe a total of $3,000 there. It's just when do you pay it and who pays it? Is it you paying it right now, or are you paying a little bit for a will and then your estate's paying for probate later? Oftentimes, estate planners will meet with you for free for the first meeting. And so I do that, for example, and you just build that cost into if someone decides to go forward and actually do their estate planning with you, the cost is just built in to that flat fee. And if people meet with me and they don't like me, which is common, it's understandable. It shows good judgment probably. But if they meet with you and they say, you know what, Dave, we don't want to work with you, totally fine. That first meeting, there's no charge for that, and they can just go on their way. Okay. Who should have an estate plan? Okay, anyone who wants a plan different than the state's default plan. If you're married and you have children from a prior marriage, oh my goodness, you absolutely need to update your estate planning if you have not. Absolutely need to. In most states, there's default rules that will completely, what's the right, Kevin, I'm getting to that age where I can't think of words. The default rules will they will put your plan into disarray. The default rules, if you have children from a prior marriage and you get remarried and you haven't updated your estate plan, many states, most states, will provide your new spouse with certain rights that may or may not be what you want to have occur. So anyway, super important. Okay, if you have minor children, you really should have your estate planning done to provide who's the guardian. Okay, remember, wills and trusts don't control your assets if they have beneficiary designation. So 401ks, IRAs, life insurance, you need to name beneficiaries for those types of accounts and understand they go outside of your will or trust. Sometimes you might want to name your trust as the beneficiary of those accounts. But we never, 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 never transfer 401ks or IRAs or any tax advantage type of account. We never transfer ownership of that account while you're alive to a trust. Immediately becomes taxable and it's a nightmare. Okay. Okay, very good. Okay, potential problems, procrastinating, failing to hire someone who knows what they're doing. If you're going to have heart surgery, you don't want to hire a foot doctor to do your heart surgery. Same thing with lawyers. Find somebody who knows what they're doing. Another problem is failing to revise an estate plan upon major life events, death, divorce, fallings outs. I've heard it both ways. If you fall out, have a falling out with a family member, something like that, and failing to coordinate your life insurance, your retirement accounts with your estate plan, because again, the will or the trust does not control the distribution or the dispersal of your life insurance, 401ks and IRAs. Okay. Questions? All right, I'm done. Yay, Kevin, I saved you some time, a little bit.
Thanks very much, Dave. And as a prelude and an introduction into our discussion and questions and answers, we want to give an opportunity for Tana to give some of her perspective and experiences as a person living with HIV and aging with HIV on the planning for long-term care and estate planning. And Tana, if you can just give us a few minutes to give your perspective on long-term care and planning for older adults need to be thinking about, and as I said, your experiences.
So, hi everyone. Nice to be here today with y'all. I am Tana Pardia, living with HIV for 25 years. These two presentations Kevin and Dave gave were great examples of what most people, long-term survivors living with HIV, don't think about. We don't think about things like this. And the reality of it is a lot of us don't have the funds to even think about hiring anyone, but also just thinking about long-term care is something that we really don't think about. And for me, who has had to navigate the systems of what my care looks like, and also being on Medicare for a number of years, is that it is very important, and I'm gonna be real, because I almost died in 2009, and my insurance lapsed because of having to be in the hospital for a long length of time, about 6 months to a year. So there was no insurance. Plus, there was a donut hole as far as medication was concerned and all of that. But these are things that, you know, made me think about then and now. So, as I am a long-term survivor, but also someone turning 65, it is very imperative that I do my research on anything. Having a will is very important, but also just making sure that my quality of life is being met. So one of the things that I do, and I do as an advocate, is not only for myself, but I tell my community that when you are researching for insurance, like Medicaid, I have never been on, but Medicare, I have been on since 2000. And one of the things that I find is that making sure you do your research on what insurance plans or what company you go with is very crucial to my quality of life, because I've had an insurance plan that didn't fit or didn't make any of my needs. I couldn't see my specialty doctor, couldn't get my medication, and I was not told any of that. I didn't have anyone to walk me through. So I went through basically almost a year with no care because of choosing the wrong insurance plan, but also if it wasn't for a doctor that really took me under his wings to get me to from then to where I'm at today, I would have died. And he basically paid for my care when I didn't have insurance. And that is something that rarely happens. But what I tell people now, and I had to navigate insurance in 2025, this year, navigating not being able to go to the doctor that I've been going to for 25 years, 24 years, and having to figure out what the hell am I going to do? Here I go again. You know, the way the system is, uh, just really from my previous experience up until now, if I didn't learn the bumps in the road, I would probably be back where I was in 2009 or 2010. But one of the things I tell community, and I even tell myself this, it is important that I keep my daughter in the loop, my children in the loop of whatever is going on with me, because they have the they have more patience than I do. So they help me through this process. But also one of the things was, okay, how much is it going to cost me for a specialty doctor versus primary care? Just these different angles of different, different doctors. Specialty doctors cost more than a primary care doctor does. So, but I need that specialty doctor because I need my HIV care being met. But also, one of the things is I want a doctor that really is going to listen to me because honestly, we are the experts on our bodies, but also our lives and the quality of life that we as long-term survivors. My bones ache, my back aches at times, and I'm just being as transparent as possible. But me having to navigate 2025, uh, trying to figure out, I got to find a new doctor. I got to make sure that my medication is on the formulary. I got to make sure that, do my plan have vision? Do my plan have Part D? Turning 65, do it has Part D because that's something that you have to have now. If I ever get to a place that I need someone to come into my home to take care of me, all these things play a role in my quality of life, but also the community. For me is my struggles help my community. When people come and say, "Oh, Tan, I'm having such a hard time. This insurance company, I can't go to this doctor. Can you help me find someone that will help me?" And all of my struggles has helped me navigate other women, but other people in the community living with HIV, long-term survivors, our young people, because we tend to think that our young people aren't long-term survivors, but they are our dandelions. You know, their bodies might be a little bit worse than my body because they were born living with HIV where I wasn't. So, just really navigating how to use my finances the best way possible for my care. And my care and my daughter stays on me all the time. I want to see your numbers. I want to see she wants to see everything. And when comorbidities happen, my daughter is the one that has to take care of me. So just making sure that we have the right plans, but also having someone that we can talk to navigate us through this. Because I've had to navigate a lot of people through 2025 because of the way insurance companies are wanting to dictate to us what medications we can take, what medications they are allowed to pay for, and all of that. Thank you. Pass it back to you, Ronald.
Thanks very much, Tana. And again, thanks to Kevin and Dave for thorough presentations and getting us started. There have been some questions in the chat, and Sheila, please help me in monitoring those questions. One question that came up, and Dave had mentioned this, came up during Kevin, your presentation. Does a person have the option to sell their life insurance and use the money to establish a long-term care annuity?
I don't know if sell is the right word, and Dave, I may need you to take off your attorney hat and put on your tax professor hat and help me. This has been a long time since I know that you can do an IRS 1039 exchange if I'm remembering my IRS codes correctly. What I don't remember is if you can exchange life insurance to an annuity or annuity to life insurance. It can only go one way, right, Dave? You can't.
So that's my understanding. I haven't looked at that in quite a while either. I think that's a question that would be worth looking into if that's
I'll have to research that. But one thing I'm going to do a real quick commercial on viatical settlements. I hate them as a former life insurance agent. Normally, they completely hose the person selling the life insurance policy It was so bad that LIMRA, the Life Insurance Marketing and Research Association, put enough pressure on the larger insurers that they now have automatically in a good life insurance policy. You can always do that if your health takes a really bad turn for the worse. I believe the IRS allows you to do it up to 96% of the face value, and 96 cents on the dollar is a hell of a lot better than 15 to 30 cents on the dollar, which you get with a typical viatical settlement.
One question which, thank you, Kevin. One question that I think really is a paramount one, if I can be so suggestive, is when should a person start planning for the long-term future? Is there an optimal time other than yesterday? When should a person start? And perhaps Tanner, Dave, and Kevin could bring your perspectives on when should we start planning?
I would say I would start planning before I get sick. I'm gonna be totally honest, because I think starting um in your 50s, just really thinking about, what do I need when I do become of age. Um, for for me, because I waited till I was almost on my deathbed to figure this out. But also I had used up all my savings trying to stay healthy too. So I would say the sooner the better, especially if you are a long-term survivor. It doesn't matter if you're young or old.
Yeah, I agree with Tana. I think as soon as possible. When you're dealing with Medicaid in particular, you really need to start off, you need to go talk to Medicaid. If you think you might need Medicaid, you need to go talk to them and before you do anything, because there's a lot of mistakes made. You really need to have, we could do a whole nother one of these on Medicaid planning in particular, because it's so complicated. So anyway, Tana, I loved what Tana's comments, man, they were awesome. So thank you, Tana, for sharing your thoughts with us earlier. They were so important. Yeah, super.
And from my perspective, you can never start this too early. I don't think you can start this too early because, when I was diagnosed with HIV, well, we all have a line that we're going to cross one day, and it's called the line of insurability. I crossed it when I was 37 years old in 1997, when I was diagnosed with HIV. Not going to buy a lot more insurance, disability, life, or long-term care at that point. Some of us don't cross it until the day we die. We stay insurable right up to the time of death. But for most of us, one of the things that can really be a monkey wrench in this type of planning is if you started at my age, I'm just going to turn 64. A lot of 64-year-olds have comorbidities that don't allow them to buy the kind of products they'd really like to buy, no matter how much money they have. And let me phrase this correctly because I don't want to violate privacy. Dave might know who I'm talking about because Pocatello is kind of a small town, but the largest long-term care case I ever sold was to a husband and wife, and he was 84, the wife was 82. We quit selling it at 85. He said, "How much are you going to spank me for doing this so late?" And I said, Ron, that's a really good question. And I went back to my office and I figured out what the premium he would pay from 84 to, let's say he died at 94. Then I did the same calculation for someone buying it at 35, also dying at 94. And the premiums, the cumulative premiums were $100 apart. So financially, when it comes to how much premium you're going to pay, again, any age is good because the insurance company is going to get their damn money one way or the other. Whether you start at 35 or 64 or 84, in this gentleman's case, they're going to get the premium dollars they need to make sure that they stay viable and can pay claims at the end.
Thanks, Kevin, and thanks, Dave and Tanner. One question, and been jumping around some of the questions, but I think this is a question that has come up, and I know something place that I have felt. If you don't have a large estate or a sizable, Elon Musk size wealth, what is the value of setting a will? Or could you just, I mean, some of us think like myself, think, oh, will is for rich people, and with people with lots and lots of assets. Could you just re-emphasize the value of everyone thinking about the probate process, the wills, and how we take care of our loved ones after our death?
Yeah, that's a great question. If you don't mind, I'll jump in on that. So I think everybody who has loved ones that they may want to leave assets to should have at least a will. And Tana brought up such a great point. Some people may not have the resources to go pay an attorney, $1,200 to get a will, or $3,000 or whatever. Your state might be even more. Now, there are resources out there for healthcare powers of attorney. Hospitals almost always have healthcare powers of attorney, just blank ones. You can go to the hospital and just say, "Can I get a healthcare power of attorney?" and just fill it out right there. Financial powers of attorney, oftentimes you can go to your state court. If you go to like the Colorado State Supreme Court website, a lot of time, I'm not in Colorado, but that's an example. You can go and you can find financial powers of attorney online that you could print off and use. Now, wills have very specific requirements for them to be valid. So in Idaho, for example, they have to have two witnesses who sign saying, "Yep, I witnessed the person signing this will." So you got to follow certain formalities. You got to be careful of those things. LegalZoom.com, if you really don't have much money, you could go to LegalZoom.com and try that. The nice thing about going to an attorney is you get some professional judgment and you get to bounce ideas around. So we really need to figure out a way. The other thing you might do if you don't have a lot of funds is you might call your state bar association that regulates attorneys in your state. Oftentimes there's attorneys who will offer pro bono services for things like estate planning or guardianships, conservatorships. Someone mentioned in the chat a question about guardianships, conservatorships. That would be a really good thing to talk about. So I think, Ronald, if for everybody who has a loved one they want to leave assets to should probably have a will. It's not a question of how much money you have. Trusts, maybe a little bit different. A trust is kind of a luxury. It's kind of like getting a Cadillac when an Accord will do just fine. A Honda Accord will do just fine. But I would say don't even think about doing a trust if spending $3,000 to $5,000 is going to impact your current quality of life. Don't even think about a trust. Go find someone to help you do a will. That's what I would say. I don't know, Kevin or Tana, if you guys want to jump in on that.
Yeah, I'll jump in because there was also a question about conservatorship, and I know this stuff is expensive. God knows I have written Dave plenty of checks over the years. I have, but if you can find the resources to do this, there's so many things that you can pre-plan. My grandmother in Virginia, top realtor, had quite a few assets. Ended up with dementia or Alzheimer's, and by the time she died, everything was gone. She owned her home, one other piece of property, and it had about $60,000 in the bank. She didn't do any of this. And my mother and aunt were getting ready to call an attorney like Dave to go into court and tell everyone in Newport News, Virginia, my grandmother was no longer able to handle her own affairs. That is something you never want to put your family. I would sell blood before I would put a family member through something like that. Now, my grandmother ended up dying shortly after that, and so it didn't become necessary. But there's so many things that you can keep families from having to go through. People like Dave and I cannot help take away everything that's going to come with when a family member goes through long-term care, no matter what level it is, and then eventually die. But we can help a lot of the road bumps go away through that process to make one of the worst points of everyone's life a little bit less bumpy. And that's why this is so important for everyone to do, whether you have a $1 in the bank or whether you have however much Musk has.
And I will also say, living through COVID, because I saw somebody write COVID in the chat box. I have had to live through the family of going at it without a will. And I have to agree with Kevin. It is necessary to have a will, but like here in Houston, we have volunteer lawyers that could help individuals get a will written and notarized and all of that. But from experience of going through it with 17 family members during COVID, it was a lesson learned that a will is truly necessary to hold the family together. I'm just gonna be real, to hold us together.
Thank you, Tana, Dave, and Kevin. We are at time, but I think I will say that this has been an incredible and very rich discussion, and we've just, put the tip of the proverbial iceberg on this subject, and this is clearly something we need to continue to talk about. There are some questions that came up that we weren't able to get to. The slides, as Sheila mentioned, will be available. And on behalf of Sheila and the staff of ANAC, I want to again thank Kevin, Dave, and Tana for this discussion. I want to thank all of the participants who were engaged by your presence in this webinar today. It was noted we did last year, there was a series on Medicare. We may have to think about repeating that series because we need to keep our knowledge and awareness and as the changes come. So again, I want to thank everyone for being here today, for leading us through this discussion and helping us to focus on things we often don't talk about, the long-term care, our lives, and our loved ones after our passing and transition. Difficult subjects, but we need to talk about them. We need a community like those of us here on this webinar to support us. And people like Dave, Kevin, and Tanner are there to be resources for us. Again, thank you. Sheila, any closing remarks?
No, Ronald, I think you summed it up beautifully. Just add my own thanks for our panelists and our faculty today. It's been really wonderful. Ronald and I talked a lot about what we heard from us attending other types of conferences and webinars that we weren't seeing this particular issue covered really in many places. And it is, an issue whether you have, you know, $500 to leave behind or $5 million to leave behind, you still really want your wishes fulfilled and not, as Tana said, not to this, not for it to become an argument amongst the family. So really, thank you both. I think this has definitely been informative. And I certainly jotted down some notes for myself and for my own family. So really do appreciate it.
Take care, everyone, and have a good afternoon.